Hi, I'm Jessica. I'm a student pharmacist at the University of Minnesota, and today I'm teaching you how to use your Breo Ellipta inhaler.
So inside your inhaler case, you're going to find two things. There's going to be a desiccant to keep the inhaler dry before you use it, and that's represented by the lens wipe, and then the straw holder is represented in the inhaler. On the side of the inhaler, you're going to see a counter, and that's going to help you keep track of how many doses you have left. If you open and close the inhaler without breathing in, you've lost that dose and you can't get it back, but you won't ever accidentally double up. To use your inhaler, you're first going to open the cover and that loads the dose up for you. And then you're going to make sure you sit up straight and you exhale away from the mouthpiece. Take a big breath, get out all of your air. But you don't want it to be going over the mouthpiece. That's going to not make you have the most effective time. So make sure you get that big exhale out away from the mouthpiece. Then you're going to seal your mouth over the mouthpiece. Make sure your fingers aren't covering the vents. And then you're going to take a big breath in. Then you're going to hold your breath for 3 to 4 seconds or whatever is comfortable for you. And then you're going to have a steady, slow, gentle exhale out. And then you close the inhaler lid. And then you're done.
Once you're done using the inhaler, and it's closed and whatnot, you need to make sure to go rinse your mouth out and spit out the water that you use. That ensures that you can avoid one of the side effects, which is oral thrush. So it's just very important to rinse out your mouth and spit out the water so you can avoid that. Next, we're going to go over some general info about your inhaler and how it works and what it does for you. So once you've opened it, the best way to keep track of making sure it's good or not is once you've opened it, just mark down a date that is 6 weeks after when you opened the case for the first time. That's going to make sure that you have it good for the time that you're using it, or when your doses are out. Whichever is earliest, that's when you need to be done with the inhaler. You don't want to break the inhaler apart and try and refill it or anything. It's a one and done situation. Once it's out, it's out. You can use a dry tissue after you put your mouth on it to kind of clean up, but no heavy other cleanup things are necessary. It helps to make sure you get a refill when you have about 10 or less doses left. That's going to be when it's about time to make sure you have another inhaler ready to go. This is a maintenance inhaler, so it's going to help if your asthma or chronic lung disease is not fully controlled. So that's what it's indicated for. So anytime you have something where you're having the wheezing and coughing and it's not controlled, this is a maintenance inhaler for you to use once a day to help reduce those symptoms and kind of get it under control. Unfortunately, there are some common side effects. So some of them can be difficulty talking, oral thrush, but you can solve that by making sure you rinse out your mouth. You can have some mouth or throat pain you can also experience a headache or some bronchitis. That can happen if you're not keeping it clean and just making sure you kind of have it out of the way. You should start to see a reduction in symptoms, but this is also a maintenance inhaler, so it might not be right away, but a lot of studies have shown that at the end of 12 or 24 week periods, so after 3 to 4 months, they've seen that reduction in symptoms, and then you can kind of check back with your provider to see if you can maybe ease off of it, if that medication has kind of actually gotten the condition under control. If you miss a dose, don't double up on one day. That is not going to be helpful or good for you. You're going to feel more likely to feel the side effects if you do that, so you don't want to double up. But just if you hadn't taken it that day and it's not at the usual time you take it, you can go ahead and take it. But make sure you're never doubling up. If you're I completely forgot yesterday, you don't want to be I'll do 2 times today. Don't do that. basically a way to monitor to make sure it's working for you is to see, like, am I having those situations come up where I'm coughing or wheezing or not feeling good about my breathing more or less often, and keeping track of like what triggers that will help you be able to see if this is working for you. So we went over a lot of different things. Another way that you can help monitor your symptoms is when you're keeping track of those things that may aggravate you, to try and minimize interacting with those in your life. Sometimes you can't help it, but that's one way. So, example, if dust triggers it, have your support group or you clean, like, dust a little bit more so you don't have that agitating you. So just, if you have any questions or you want to review it with me, that's always an option. And also on inside your inhaler case, they'll have instructions to like review what we talked about today. And you can always call our pharmacy, call the pharmacy if you have any additional questions.